Aloha and welcome back to the Kupuna Connections television program. I'm Cullen Hayashida, the host for the show, brought to you by the St. Francis Healthcare System of Hawaii. Every week we bring a different topic having to do with active aging, as well as for our seniors out there that perhaps may be in need of family caregiving services. The topic that we have today is called Brain Health, Mental Fitness Tips for Active Aging. And we have with us two very important guests that I'd like to introduce and have them personally introduce themselves. Let's start out with Jody.
Okay. I'm Jody Mishan. I work for Center on Aging on a new grant from the Administration for Community Living given to Hawaii. Hawaii is one of 11 states to get it. It's called the Alzheimer's Disease Initiative, and the purpose is to increase long-term services and supports for people living in the home with memory loss and their caregivers.
Yeah, and you used to be with the Executive Office on Aging in a similar type of a position having to do with Alzheimer's disease, right?
Yes, I was coordinating the state plan on Alzheimer's disease and related dementias.
Right. So lots of experience, and a lot of dedication. Pamela.
Hi, Colin. I'm Pamela Ani. I'm the program specialist with the Aloha Chapter Alzheimer's Association. Been with them since 2012 and was director of programs for about a year and then flipped over to program specialist. So now I have the privilege of doing the lectures, the presentations. I do the consultations with the family, and the favorite part for me is being able to do the classes that we hold for the caregivers with the association.
Great. Okay, so we got two experts here in Hawaii that will be able to share with us not only about dementia, but much more specifically about brain health in a more general sense, right? So let's, with regards to this whole issue of health and aging, we know that people are living longer. We've got much more seniors and boomers that are retiring. And I guess older people are also wondering whether or not they can improve on their health, being that they are, let's say, older today. I mean, if they were not necessarily taking care of their health earlier, is it still possible for them to improve their health?
Yes, I would say that absolutely all of us are able to change our habits. And in changing your habits, it's been shown scientifically that you can increase your health benefits. That's for the body and for the brain.
Definitely. You're never too old and never too young.
Oh, okay.
And start moving something somewhere.
Just
make changes.
Make changes. Okay,
small changes, but make them small, but make them last.
Okay. So then if we were then to talk about the brain, clearly, if you got a healthy body connected to your brain, so it probably will have some impact as far as having a healthy brain as well.
Well, as of now, there's no cure and there's no prevention for the Alzheimer's disease. But one of the things that we have found out is so closely related is the heart-healthy, brain-healthy connection. And so what we're trying to do is encourage people to eat, to live, to be heart-healthy, because we're finding out that that's the oxygen that needs to be sent to the brain to get everything cleaned out and charged and keep it going. And another thing to help to keep those plaques and tangles from forming.
Okay.
So that's probably, if you wanted to wrap up everything in one nutshell, it would be heart healthy, brain healthy.
Heart healthy, brain healthy, not just, okay. That's much more specific in many respects with regards to physical health and healthy brain.
Definitely.
Okay.
Definitely.
Now, let's go back as far as, the term, I guess, you use Alzheimer's, but there's dementia in a much more general sense, right?
Correct.
I guess there's various kinds of conditions that are related to brain health. And we have a slide that you shared with us with regards to one of these conditions or these various kinds of conditions. Can you kind of share some things about this?
Well, we have what we call reversible challenges, and then we have the irreversible dementias.
Right.
Dementia is your umbrella term that is basically just referring to a cognitive decline.
Yeah.
And so there are there are various other elements that would also come in to cause that decline. You've got your heart disease, you've got your high blood pressure, and that can also increase what we talk about with the vascular dementia. But those are things that can be reversed if you
Okay.
learn to come in and how to take better care of the heart. Then of course you've got your diabetes, which you can also work on as far as exercising, losing some of the weight, trying to eat a little healthier, that the diabetes would not be reacting to. Then you have your Alzheimer's disease. Alzheimer's disease is responsible for about 70% of all diagnosed cases. However,
dementia?
Of dementia. However, that's also changing because we're finding out more and more that people have what they call dual diagnosis, where 60% of Parkinson's disease have Alzheimer's disease. And then you've got your strokes, which cause dementia, and that is something that would be irreversible.
Okay.
Traumatic brain injuries would be irreversible. Depression would be reversible.
Right.
Sleep challenges would be reversible.
Okay.
So, and this is another thing that, if you will let me just put this little plug in here, that's another reason you want to do an early diagnosis, is you don't want to just say, Mom's getting older. It's just dementia. It's normal. First of all, it's not normal. You've got 92-year-old people that are absolutely brilliant and active. And then, so you may go in and you may find out that she has a reversible challenge. And you're catching it early enough so that it does not cause long-term injury to the brain.
Okay.
And I'd like to add here on the traumatic brain injury that it can be avoided if you don't play contact sports and get hit on the head a lot. We all know that they're proven that it causes dementia,
Right.
but you know that if you prevent falls, that is one way to do preventable traumatic brain
Definitely.
injury. And also with depression, that mimics dementia and memory loss. If somebody is severely depressed, it's good to find out because it can mimic it. You can
I
be depressed
see.
and people might think that you
Yeah.
have dementia, but you actually are depressed.
You're just
And
depressed.
it's causing the challenges that come along and some of the symptoms that do
Yeah.
mimic
Yeah.
the dementia.
There's a need for an assessment.
cognitive
basically,
decline,
yeah,
right,
to
right.
clarify that. So with the traumatic brain syndrome or the injuries, you know, there's this new movie out, Concussion, right, that addresses that particular problem with regards to
It's a great
football.
movie. We saw it. It's a great movie.
Is that
yes,
right? Yeah.
Yes.
Okay. Well, I think one of the slides that you also shared with us had to do with what is what a normal brain looks like versus an abnormal brain. And perhaps you can kind of explain some things that we're looking at here.
Well, if you see at the top left hand of the screen, you've got the brain of it is an elderly person, and it would look a little different than a younger person's brain would. But you've got your appropriately mapped out brain there. But then when the plaques and tangles come in, it starts to form pockets. And where those pockets form, the brain also begins to diminish or it begins to die where those pockets are. And then on the outside, it also begins to shrink. So if you look at your bottom right-hand corner, you're actually going to see the holes or the pockets in the brain, and you'll see the obvious shrinkage of that brain of the Alzheimer's patient.
I see. So,
One thing I'd like to add is it's very important to note when you look at the physical brain changes that a mom or dad or grandmother or granddad, if they are having memory problems, it's good to get a diagnosis because you can't help it. When the brain is deteriorating like this with dementia, they can manifest with not cooperating, maybe arguing, maybe some of the early symptoms. So families, if they're seeing this in their loved one, they should really go to a doctor because there really are physical changes going on in the brain.
Right,
So
right.
if you're worried about the memory of somebody you love,
Yeah.
you should see a doctor or call the Alzheimer's Association.
Right.
And
right.
you know, Jody, the biggest mistake families make is arguing with their loved one.
Oh, yeah.
And trying to do those reality checks
Right.
and trying to sit down and reason with them.
Yeah.
But the frontal lobe is the first part to die. So there's no rational.
You're not
there's
going to
no-
win that argument.
Oh,
if-
no,
No.
you will not win it. And you're not going to even be able to get them to understand
Understand.
your perspective.
Right, right. So,
And so it's so important to get the diagnosis, knowing what the challenge is, and then being able to get into the world or the reality of what your loved one's reality is.
yeah. And oftentimes, I guess, we say, well, mom's getting older, we can't do anything about it. Rather than, as you point out, taking the initiative and seeing a doctor for an assessment to see whether or not
Correct.
it's something that is reversible or not reversible. yeah.
Exactly.
Yes.
Yeah.
Exactly.
Okay.
And also being able to, once you know what is causing the cognitive decline, then being able to go in and say, okay, now these are the tools that we're going to use to be able to make mom's life better for her where she is right now, because this is not about us. This is about mom.
yeah.
And mom is, we don't want to take things personal because it isn't mom who's doing this. It is the disease that's
Yeah,
talking to
yeah.
us. So.
Now, this is easier said than done, of course.
Oh my God! That's why you got to come to the classes,
Yeah,
or
no,
get at least with somebody who has been there, done that, and been able to walk you
Right,
through
right.
what would be better approaches.
Right. There's a lot of times when you just have to bite your tongue. Yeah.
Oh yes, yes.
Right. Now, so here, we've been kind of making reference to dementia and some of the issues with regards to poor brain health in that respect and some of the things that cause that. Now, let's switch over to what can we do? What kind of tips can we come up with to foster good brain health? And you had some things having to do, for example, with physical health and exercise. So what can you share with us about how those things can be of help to us?
Well, there's actually 4 areas that have been studied, and in those 4 areas there, number 1, we talk about to get moving. But I want to say this is not only for the one who is wanting to maybe stay off the dementia or else reduce its impact, but these are great things for a caregiver who has found themselves in the position, because we said just a little bit earlier that we got to just bite our tongue. Well, what happens with that is we hold it all inside. So we have, it's right now estimated about 65 to 68% of all caregivers end up in the hospital before their loved one does. And so we have to be able to teach the caregiver how to take care of themselves. So we say the tips that we have here, it is great for all of us to follow, but it's even better even if the caregivers could begin to follow this. So number 1, physical activity, being able to up your game, whatever you're doing right now, change it up, make it just a little bit more intense so that your body gets more from the workout. If you're not walking, start walking or swimming or do something. You don't have to prep for a marathon. It's like what we said earlier, start small. Find what you like to do.
Yeah.
If you were accustomed to riding a bike before, maybe you would want to ride that bike again.
Right.
If you liked going on trails and just walking, maybe you would enjoy doing that again. Don't do it alone. Have a friend with you, have a couple of friends with you, because they're also going to be your motivation to keep going with those friends. And then the other thing is your diet and your nutrition, to stay away from the processed foods.
Okay. I think you made reference to another health issue. It has to do with the heart, and we had another slide that you shared with regards to taking care of your heart. And what can you share about that?
Well, anytime you're doing these changes, like with your attending to exercise, you are leaning more towards being heart healthy. And we recognize that whatever is heart healthy is also brain healthy. And so when you are exercising and you're getting the heartbeat going and getting it to where it can push that blood up through the heart, because 30% of our blood is being shot to the brain with every heartbeat. If we're intense doing a study, research, etc., 50% of it's being shot up. So this is why sometimes when we are intensely working but not physically working, we are tired, and that's because the heart is working to get the blood up to the brain.
All right.
I just wanted to add something about the smoking and the alcohol. A big study that was done, there was a World Alzheimer report that if people can Google World Alzheimer Report 2014, it was about risk factors. They discovered that smoking has a lot to do with increased risk of dementia. They just finally made that, you know, an actual statement a year ago or 2 years ago. So that's very important. Alcohol too, in moderation.
Okay. I think another thing that you had pointed out earlier had to do with what you eat and eating healthy. So how does that relate to a good brain health?
Well, the second part of exercising would be to accompany that with good nutrition. So you want to stick to your fruits and vegetables, your whole grains. You want to stay with your lean meats and eat more fish, more poultry than perhaps the pork and the beef. If you're going to have dairy products, use the non-fat or the low-fat dairy products.
I see. Okay.
You want to stay away from your processed sugars as much as possible. You want to stay with your vegetable oils. You want to use your proper portion sizes. Make sure you're eating more vegetables and fruits than meats. And then always make sure you're getting enough water. I know we talk about adequate fluids, like what it says on the screen, but specifically water. Very few of us drink enough water.
Now, there's certain kinds of diets you oftentimes hear about. Are there anything that we should help us
for the
remember
Alzheimer's
some of these things?
Association, we refer to the Mediterranean diet, which is not a diet to lose weight, but it's a lifestyle change.
Okay. And it takes into consideration many of those things that you
correct.
pointed
It
out.
stays away from the processed foods, leans more towards your complex carbs and your whole grains. And then also the DASH diet, which is the heart healthy diet.
I see.
Those are the two that we like to blend together.
So yes, and also the MIND diet, it's an acronym, MIND. It's sort of a combination of both, but it's another really good diet. You can look
Okay.
it up online, MIND.
Okay, so we've heard of three here. So it's Mediterranean, the DASH, and the MIND. Okay, so maybe our viewers can check out the web and see whether or not there's more information that they could follow along. Now, it seems maybe a little bit confusing here, but I guess using, some people say, well, use it or lose it, right? I mean, with regards to your brain, if you don't exercise your brain, then possibly you may have some lessening capacity down the road. What do you think?
We do definitely have found the benefits of finding that cognitive stimulation and keeping that, of course, a motivation as well, but with that cognitive stimulation, we're finding it's very much like muscles in the body. The more muscles you build, the stronger you appear to be, the more endurance you have to do some of the tasks that need to get done. Well, it's very much like the brain. If you continue to push those cells out there and you get the branches going in the brain and you're forming more in branches, then if there would happen to be a part of the brain that would start to decline, you've got other parts that would be more apt to come in and take over. And that's what you want. You want to keep forming parts of the brain because we use very little of our brain. We have so much of it that's not used.
So we need to do things that is mentally active in
Exactly. Do your puzzles, do your crosswords, play games, play card games with friends. Find things that are challenging. It's never too old to learn a new language. As we get older, it's going to take us a little bit longer than it did when we were 20, but we can still do it.
Yeah.
So learn a new language.
Okay.
If you're not computer literate, pull one of your grandchildren on the side. They know it all, and let them teach you.
Even traveling.
Traveling, yes.
sort of just takes you out of your element, and requires you to realize that you've got different streets and you really have to use your brains
Yes.
with regards to direction. So it's a mental
Exactly.
exercise in many
Unless,
respects.
of course, you're like me and always pull it up on your GPS. But I kind of cheat with that one.
Yeah.
But the part I like about the traveling is if you do travel to other countries, we want to know a little bit about what we're going to do. So what we're
Absolutely.
going to read, we're going to research, we're going
Right,
to talk
there's
to
a lot
friends.
of
Have you
mental
been
activity.
there? What do you see? And so we're always learning new facts about that place.
Right, right.
I'd like to mention about cognitive aging, what is normal versus not normal. And there's a current thing about for cognitive aging. When we age, we do slow down and we do forget. It's normal, you know. And there's a study by Institute of Medicine on cognitive aging that talks about that. Normally, you know, we're not, as we age, we can't juggle as many things perhaps, and it's normal. So not to give ourselves a break when that happens. If we forget somebody's name, it's normal aging.
Okay.
And the other
Okay.
flip side of that is that, yes, as we get older, we aren't able to perhaps be as multitasked as we were. But you have to also understand that we've got a lot of good stuff we've put in there. And so we're hanging on to it all. And so having to do recall. And sometimes that's hard because it's got to get through all the stuff that's in there.
Yeah.
But
Okay. So this mental activity, use it or lose it, is an important point to keep in mind.
highly important.
And then I guess this is also this other thing, point about staying engaged or being connected. People that are recluse or hermits, so to speak, probably are in for more trouble down the road. What can you say about that?
People who are recluse, people who want to be alone, we find out they have higher and much quicker rate of dementia or cognitive decline. And so we have found that with the studies, which it may sound so minute to some of you, but keeping yourself in activities that mean a lot to you, you will feel healthier, you will feel happier. The social activities, we're finding out that it actually does reduce your health risk, because one of the other things too is it makes you get up and just go. And if something isn't quite working, you've got a friend there who says, you know what, you're coughing a little more today than you have been, or you're a little more sluggish today. Let's go to the doctor and find out what's going on. So you've got your friends who are also keeping check on you. But don't eat dinner alone. Find somebody to eat dinner with, to have a camaraderie, because people who do, they have a happier and a healthier life. It's
Yeah.
been proven.
Well, there's so much of our older adults are faced with loneliness and depression, and boredom, and these are huge. I mean, they're not medical problems, but they do create medical problems in many
Correct.
respects. I suppose eventually it can affect the brain as well. I guess.
Well, the depression itself can mimic challenges with the cognitive decline. It can mimic even some of the Alzheimer's characteristics. So you want to address those issues.
Yeah. So being socially connected is very
Oh,
important.
very important.
Okay.
Yes.
Now let's look at. Is there some local research here in Hawaii that we can reference? Is it connected, or does it support what we've been talking about so far?
Yes, there was a groundbreaking study done here called the Honolulu Asia Aging Study. It started in '65 to study the hearts of over 8,000 Asian American men. There are also cohorts in Japan and on the mainland. And all over the world, this is a famous study, and they discovered that untreated hypertension in midlife, but not late life, is a strong risk factor. But that is modifiable with treatment. Actually, it's quite remarkable that the increased risk of developing Alzheimer's in late life about 25 years later had a 4.5-fold increase for those that were untreated hypertense. So low physical activity is another one that we've talked about that. They discovered that just walking a mile a day or whatever can really help and decrease incidence of dementia. Also, low social interaction, as we've just mentioned, is associated. They broke it out into groups, and those in the lowest social engagement group had over double the risk of developing new dementia 6 years later compared to those in the highest social engagement group. So yes, you can look it up, the Honolulu Asia Aging Study.
Okay.
Yes.
Okay. So you know what is significant, I guess, with regards to this is a massive study, yeah, right? And it's been over many, many years,
Yes.
decades, in fact, and so it's basically substantiating much of what you've been saying so far. So
Yes.
this is good information, supported by science, right? Now, let's say I want to get started. Okay, what can you say about how do I begin? Where do I start? Well, what kind of suggestions would you have?
Well, I think the first place you need to start is probably with your physical activity, and start, like what we said earlier, find something that you like to do. Start slow and then start from there, and then little by little try to change your diet around. Don't try to go and do it all in one time.
We have a couple slides here that I think you might want to share, just some basic
Oh
ones.
yes, this is, the Alzheimer's Association is very important, but there's also a government website now which has a lot of resources.
So take a look at that. And the second one that we have,
Oh yes, this one gives you everything you need to know about brain health, and it has PowerPoints you can teach other people. It has a guide. It's put out by the Administration for Community Living. It's a really good resource.
yeah, so this is a little bit difficult to follow along as far as the website address. So if you were to just write that down and Google it, probably you'd be able to
Yes.
find that information, right?
Definitely.
Okay. Now we're just about out of time right now, so I'm going to ask if we could at least have your Alzheimer's information as far as contact.
There is a 24/7 number that can be called at any time, 1-800-272-3900. The patient themselves can call, or the caregivers can call at any time for help. There will always be a professional on the end of the line, 2 o'clock in the morning, ready to help you. We also have the world's largest resource library, and that is at alz.org, answering just about any question that you might have regarding any age-related dementia. Then we also have our local website, which is alz.org/Hawaii.
Okay, so viewers, let's take that information down. We're just about out of time, but I wanted to ask both of you, having covered so much, if you had one last thing to say to your viewers out there, what would you say, Jody?
Oh, gee whiz, it's hard to limit it to one. I would say that if you're worried about your memory loss, call your doctor or the Alzheimer's Association. And as far as brain health, start with 10 minutes a day walking, or add 2 vegetables to your diet every day.
I like
Okay,
that.
Pamela, what?
If you are concerned of a loved one, whether it be a family member or a friend, get the diagnosis as soon as possible, and then from there you can find out how you're going to start your journey together on the new part of the life that you didn't think was going to happen. But it's there, it'll be in your face, and the best thing the family can do is get together, make plans.
Okay, so that's it for this particular program on brain health, important tips for active aging. This is Cullen Hayashida with the Kupuna Connections television program, brought to you by St. Francis Healthcare System of Hawaii. See you again next week. Aloha.